Should people with PTSD be encouraged to talk about the trauma?
Yeah, they probably should. I think that's a good thing to do. PTSD is actually like a severe anxiety disorder that happens because of some horrible trauma that's happened. Probably the most common is people that have been in war, seeing people die in front of them, different things like that happens. They should get treatment, and they should talk about what happened.
So what are the best treatments for PTSD?
Usually antidepressants are used, SSRIs, it's serotonin reuptake inhibitors. They usually start with low doses and work their way up, increase it gradually. They also can use benzodiazepines, which are anxiolytics. That can help too, but that can help them with sleeping and stuff, because these people tend to have sleeping disorders. They can't rest, they just can't settle themselves down. But usually SSRIs are used, and there can be other things. If they have mood disorders, they can use lithium or valproic acid or some other things. But SSRIs are usually the mainstay of treatment.
Can you ever be cured?
Well, I don't know. Cure. I do believe with PTSD there's like different classes. Acute PTSD is something that's, it's had to have gone, your symptoms have to go on for at least a month, okay? So if you just have it for a week or two, that's not really true PTSD. You have to have symptoms for at least a month. And acute is considered anything that's been like within the last 3 months. Chronic is things, I believe, that occur for over 6 months. And if people get treated and do well, as far as like stopping their medication, I mean, that would be up to their therapist or their psychiatrist or their doctor. But usually I would feel that they probably want to be treated for at least 12 months and maybe still continue with counseling throughout that time. And eventually maybe they can go off their meds, but I think it would be a, so I guess it probably could be cured. I mean, it's hard to say. There's so many, so many different cases. It depends on how everything goes for the patient. So it's kind of a tough call. Anytime you have a mental health diagnosis, do we ever really truly get a cure? It's probably not truly a cure.
What events can cause PTSD?
Any type of severe, life-threatening event, more so than just, your typical average scares. It's usually something that's life-threatening to either you or somebody else. You might witness somebody dying, somebody who, maybe got stabbed or shot. It can be a rape, it can be sexual assault, it can be a war, being in a war and seeing people die around you. I mean, really, any really serious life-threatening event that you witnessed.
What are the symptoms of PTSD?
Symptoms are usually like agitation, irritability, insomnia. They can be feeling like they just can't relax and rest. They keep maybe thinking over and over about what happened. They might, the other opposite thing is that they try to avoid it and don't think about what happened. They might become depressed. They might become kind of forlorn, don't leave the house, kind of just, there can be various, I feel, with most mental health issues and diseases, there can be lots of different things, but to really truly be diagnosed with that, with mental health, there is criteria that they have to have, and there are certain criteria, and I'll give you a copy of this so you can kind of see what criteria is listed from a provider, at least, to know that that's a diagnosis. But symptoms usually of increased arousal also occur. Again, the insomnia, irritability, anger, difficulty concentrating, exaggerated startle reflex, things bother them. Those are some things that can happen. They might, again, they might have recollections of the event. They might have dreams, nightmares, hallucinations, different things happen.
What are the risk factors that come with PTSD?
Boy, I don't know for sure if there's any real risk factors. I guess probably if you have any underlying anxiety issues or underlying depression, if you have other associated mental health problems, you might be more likely to get PTSD. Alcohol, I think for treatment too, guys, what they want to do is, like, I'm thinking of war, maybe if they abuse alcohol or drugs, that might be something. But as far as a risk factor, it's hard to say any one thing.
Where would you direct them from here if they had signs of PTSD?
I'd probably, actually in Carroll, Iowa, I don't see PTSD. I'm sure the VA clinic does a lot. And I know Dr. Langenfeld at the hospital is very good with PTSD. So I would probably refer them on to a psychiatrist if I thought somebody had that. I might start them on a medication first and get them referred, and get them to counselor or therapy also.
Cool, thank you very, very much.
All right, you're welcome.
Thank you.
All right. Do you want this information?